A medical student in his final year from Pakistan, Ajmal Saleem, has been attending Dixie State University through an exchange program since August. Ajmal said the reason he chose his profession was to help people from every aspect.
But for me, to be honest, I wanted to cure people, not only spiritually, but also physically, mentally, socially, economically, and with every aspect.
While not all of his classes here have related to the medical field, Ajmal has taken classes in biology and culture. Ajmal believes that man needs to be complete in spirit, mind, and body in order to prevent illness. And if someone is too stressed out, they may have a higher chance of becoming sick.
And those stress factors, which we call inflammatory mediators, they are released in your blood. And this thing actually creates a good environment for microorganisms to come into your body and infect you because you become immunosuppressed.
Healthcare practices in Pakistan differ from the U.S., especially when it comes to protecting and developing immune systems. Ajmal shared that there are two types of immunities, those inherited and those acquired throughout your life. Both systems attack pathogens, but the adaptive immune system does the final battle.
That acquired immune system builds some defense lines for you. Those include different kinds of things, for example, antibodies that help you combat that kind of pathogen again, even if it comes.
Ajmal said in Pakistan they aren't that great at preventative care. However, they do believe in allowing the body to build up the immune system, especially as a child.
In your childhood, if you are exposed to different microorganisms in your childhood, your immune system is not actually very rigid at that time. It is flexible, it can mold. So if it gets exposure to different microorganisms, later in your life you may not be having that infection again, or even if you get it, you would be able to get rid of it very quickly. And it helps you get rid of some allergies too.
And he says that fear or mind-based stresses can cause the most harm.
If you are mentally strong, if you're mentally composed, if you have a good composure, it helps you because in the end, everything culminates on your immune system. Even those antibiotics, those antivirals, they are actually there to reduce the army of the infection.
However, he says with relaxation, a good balanced diet without junk food, and possibly the use of some supplements, good hygiene, and daily exercise, the body can fight it off.
So for me, the first and the foremost thing is to stay relaxed. Stress less. Keep a healthy diet. Your diet should be healthy. And you shouldn't eat this way that your stomach gets completely full. Get good sleeps. You should be able to have good sleep, because when you are asleep, there are some hormones that come into your body and that actually make you grow. Fourth, I would like to say, always do some exercise.
Orthodox or modern medicine has never been in favor of traditional or non-conventional medicine approaches. However, Ajmal believes the two could be better partners. When asked what he would like to take back to his country from the U.S.,
you have better lab diagnosis facilities. You have better facilities to investigate a disease. Some markers, some blood markers, serum markers, lab investigations that we don't have in our country, you have them and you use them very commonly. So these are some things that I would like to take back to my country from the US.
Ajmal said what doctors could rely more on here is their intuition.
For example, if you come to a doctor and you say that I am having sore throat, he would like to get you tested before prescribing an antibiotic, most of the times. But in my country, we know that if we ask this patient to get tested before prescribing him an antibiotic or any other drug, he would just go back. He won't come back again because he knows that he won't be able to afford it. So doctors rely on their clinical examination, their skills, their history taking, their intuition, their experience.
In Pakistan, around 78% of the population pays for the health care out of its own pocket, and 3/4 of healthcare services are provided by the private sector. And much like the U.S., neither country bases their healthcare system on welfare. However, in the U.S., health insurance is more prominent, where people in Pakistan must trust the doctor.
People are on the mercy of the doctor. this is not the case here. Doctor is just a person for you, and if you think that doctor isn't right for you, you can sue him. That actually disturbs the doctor-patient relationship. But in my country, patients are reliant on the doctors. So doctors take it as an honor most of the times, that we are actually the healers, the curer of different peoples.
Ajmal believes his services based upon mind, body, and soul will be needed in his country, and despite modern advancements, traditional medicine and self-care techniques will always be remedies used as an affordable option and treatment in his country. Ajmal has enjoyed his stay here and said his memories and time in the U.S. and at Dixie State will be with him always.
I would just like to say thanks to this university and my program managers that made me come here, U.S. Department of State and USCFP and IREX, and of course the first thing that made me who I am today is my university back in Pakistan. As a Dr. Khalid Masood Gondal, who actually not only worked on me, but he also worked on many other students. I'd like to thank Sir Shadman Bashir, who introduced me to many opportunities while I was here during my 4-month trip to the US. And in the last, I'm thankful to all the people I have met in the country and the country itself.
From Dixie State University, Melissa Anderson, Community Education News.